Hi, I'm Dr. Amy Killen, Humanaut Health co-founder and Chief Medical Officer. This is one of a series of videos on Humanaut's regenerative medicine program. During our time, I'll provide an overview of the Humanaut Health regenerative medicine protocols that I've designed for skin, scalp, and sexual health. At the end of the series, you'll have hopefully received enough information to decide if you'd like to take the next step and schedule a medical consultation. You'll need to schedule a consultation with one of our licensed providers to receive medical clearance for treatment and discuss personal questions. Our administrative and scheduling staff will not be able to address personal medical questions. Before we begin, I need to share two important messages. The content covered in this series of videos is for general informational purposes only. It's not intended to be a substitute for professional medical advice from your doctor, nor is it intended to prevent, diagnose, or cure any serious medical condition or disease. The use of stem cells and/or human cellular tissue products is not FDA approved to treat any disease or medical condition. The medical therapies performed at Humanaut Health, including regenerative medicine, do not claim to diagnose, treat, or cure any serious medical condition or disease. Scalp regenerative injections. Let's dive into regenerative therapies for scalp health and hair loss. Doctors have been injecting regenerative therapies into the scalp since the early 2000s, trying to stimulate hair growth and improve hair quality. Much of the research in this field has been done with platelet-rich plasma, or PRP, which is made from your own blood. Multiple studies have shown us that PRP can stimulate hair growth and improve hair density in individuals with androgenic alopecia, also known as male and female pattern baldness. In the PRP studies, they showed the importance of doing multiple treatments, usually 3 over several months. While PRP has been more extensively studied, newer regenerative therapies such as stem cells from one's own body and growth factors like extracellular vesicles or EVs are gaining attention in the hair restoration research. These advanced biologics used at Humanaut Health potentially offer more potent and targeted effects compared to PRP due to their higher concentration of regenerative compounds. In general, regenerative scalp injections are thought to work by influencing the hair growth cycle, particularly encouraging follicles to transition from the telogen resting phase to the anagen growth phase. The stem cells and other cellular components used in these treatments are believed to provide growth factors that stimulate dormant hair follicles, improve blood supply to the scalp, enhancing nutrient delivery to hair follicles, reduce inflammation that may be contributing to hair loss, and potentially activate resident stem cells in the hair follicle. While the bulk of the research so far has been using regenerative therapies for androgenic alopecia, also known as male and female pattern baldness, there is some research suggesting that hair loss from autoimmune disorders, stress or illness, and even tight hairstyles may respond to such treatments. Research suggests that maintenance treatments may be necessary to sustain the benefits over time, and that hair loss treatment often requires a combination of solutions, such as topical medications, DHT hormone-blocking shampoos, peptides, and red light therapy. Hair loss is complicated and often multifactorial, so it's important to get a full assessment by a trained medical provider if the reason for your hair loss is unknown. Who's a good candidate for regenerative therapies? Factors such as the stage of hair loss, overall health, and individual response to treatment can influence outcomes. Good candidates are people who have some hair, even if it's thinning, breaking, or not in great shape. Procedures work best in people who are generally healthy, with well-controlled blood sugar, healthy eating habits, and attention to post-procedure instructions. We advise clients to stop smoking several months before the procedure and to avoid alcohol in the weeks before and after. Although our goal is to help everyone with their hair goals, there are some people who do not get benefits from these procedures. If you're completely bald in an area and have been for a few years, it's less likely that regenerative injections will help. When we use regenerative therapies to try to improve scalp health, we are either injecting personal stem cells or human cellular tissue products from ethically sourced and thoroughly screened umbilical cords donated from live cesarean births. If you haven't listened to Dr. Harry Adelson's detailed explanation of regenerative medicine, cell types, and general treatment options available, please do that now. Prior to the procedure, we take photos, and if your hair is short, apply a topical numbing cream to the treatment area, which is left on for 30 to 60 minutes. Then we wash and prep the skin. During the procedure, regenerative cells and/or tissue products are injected into the scalp using a very small needle. The injections are spaced 1 to 2 centimeters apart, and the number of injections you receive will depend on the size of the area being treated. It's important to know that scalp injections can be painful. Of course, we do our best to make you comfortable with both numbing cream and nitrous gas or laughing gas available. The good news is that these procedures are quick and the pain resolves within minutes. After the procedure, you may have swelling, redness, bruising, and a burning sensation of the skin on your scalp. The intensity and duration of these effects can vary. Your medical provider will give you post-care instructions, and you're welcome to take Tylenol or Advil if needed. Results from scalp injections can take time because the growth phase for hair follicles is maddeningly slow. In studies, new hair growth or improvement in hair quality can take 3 to 6 months. While new research emerges every day in this exciting field, the use of regenerative medicine for hair restoration and rehabilitation is still considered experimental, and there are no FDA-approved regenerative therapies for this purpose. Thanks for watching. If you want to see if regenerative medicine is right for you, I invite you to visit humanauthealth.com to start the medical eligibility process.